Hi, my name is Mandy. I'm the community health nurse here at Tsawout First Nation. I am primarily of English and Irish descent. I grew up in Houston, BC, on the land of the Wet'suwet'en people. I grew up very integrated within the Indigenous community off reserve, and I have carried this upbringing as an honor and a gift. As you are aware, we have had a few positive cases of COVID at Tsawout this week. We work closely with the First Nations Health Authority and Island Health in COVID response. All cases that we are aware of are isolated at this time. Chief and Council have issued a shelter-in-place order that is similar to the restrictions the government has already put in place. I would like to remind you that myself and the health unit are not allowed to say who has COVID or who is getting tested. This is considered confidential medical information. If you are at risk of exposure, you will be contacted by a medical professional. If a COVID test is done too soon, it can come back as a false negative. This is because the COVID virus has not had enough time to grow enough to show up on a test. This is why it's important to always be monitoring for symptoms. A fever is not the telltale sign of COVID. Some people with COVID don't even ever get a fever. If you feel like you have a cold or flu in any way, please isolate and look into testing. I see it as brave and kind when someone is tested. It keeps us all safe. Please remember that we are all at risk, even those of us who are doing everything right. It is important to not blame or stigmatize each other. That kind of talk will only make people feel unsafe or ashamed to get tested. I would like to thank everyone who has been tested and is isolating. You are kind and brave. Thank you for keeping your community safe. As far as the vaccine is concerned, we do not know when it will be at Tsawout. The government is the one who says who gets it and when. We have no say in this, and it is unpredictable, but we are preparing for it. If you have a severe allergy to laxative or cough syrups, are on high-dose steroids or cancer medication, or have been told that your immune system is compromised, we recommend getting a note from your doctor or nurse practitioner saying that the COVID vaccine is safe for you. We are working on having an NP or GP at the COVID vaccine clinics in case you're unable to do this beforehand. The vaccine has no COVID virus in it. You cannot get COVID from it. It will only tell your immune system what COVID looks like. Your immune system will then build the memory to fight COVID before getting sick. It is the immune system working that can make people feel sick after a vaccine. It means it's working. We have had communities on the island that have been given very short notice and are scrambling for nursing staff to support their vaccine clinics. I am the only immunizing nurse at Tsawout. Sartlip has been told that they will roll out their vaccine on Monday. I will be at Sartlip for their vaccine clinics. They will help with ours. We need each other in order to get through this rollout. It is impossible for one nurse to immunize something this large on their own. As your nurse, I have been proud of how Tsawout has kept COVID away for so long. You are all amazing. Please follow the shelter-in-place order from Chief and Council. Thank you for your patience and time.